NEET PG Grand Test Set 4 Questions 76 to 100. Question 76. A patient with chronic renal failure presents with bone pain and fractures. Which condition is most likely? A. Osteoarthritis. B. Osteoporosis. C. Renal osteodystrophy. D. Osteomalacia. Answer. C. Renal osteodystrophy. Explanation. Chronic kidney disease causes phosphate retention and decreased vitamin D activation, leading to secondary hyperparathyroidism and bone changes collectively termed renal osteodystrophy. Question 77. Which of the following is a selective beta-1 blocker? A. Propranolol. B. Metoprolol. C. Labetalol. D. Carvedilol. Answer. B. Metoprolol. Explanation. Metoprolol selectively blocks beta-1 adrenergic receptors, reducing heart rate and contractility with minimal bronchoconstriction. Question 78. Which is the most common site of ischemic stroke? A. Middle cerebral artery territory. B. Anterior cerebral artery territory. C. Posterior cerebral artery territory. D. Basilar artery territory. Answer. A. Middle cerebral artery territory. Explanation. The middle cerebral artery supplies a large portion of the cerebral hemisphere and is most often affected in ischemic stroke, causing contralateral hemiplegia and aphasia if dominant hemisphere is involved. Question 79. A patient with COPD develops sudden worsening of dyspnea, pleuritic chest pain, and absent breath sounds on one side. Most likely cause? A. Pneumonia. B. Pneumothorax. C. Pulmonary embolism. D. Pleural effusion. Answer. B. Pneumothorax. Explanation. In COPD, rupture of a subpleural bulla can cause spontaneous pneumothorax, leading to sudden onset of pleuritic pain and unilateral absent breath sounds. Question 80. Which organism causes whooping cough? A. Haemophilus influenza. B. Bordetella pertussis. C. Mycoplasma pneumoniae. D. Conbacterium diphtheriae. Answer. B. Bordetella pertussis. Explanation. Bordetella pertussis causes severe coughing spells with inspiratory whoop, especially in unvaccinated children. Question 81. Which is the most common cause of upper gastrointestinal bleeding? A. Mallory Weiss tear. B. Gastric ulcer. C. Esophageal varices. D. Duodenal ulcer. Answer. D. Duodenal ulcer. Explanation. Peptic ulcer disease, particularly duodenal ulcers, is the most common cause of upper GI bleeding, followed by gastric ulcers and varices. Question 82. Which vitamin deficiency causes night blindness? A. Vitamin A. B. Vitamin D. C. Vitamin E. D. Vitamin K. Answer. A. Vitamin A. Explanation. Vitamin A is essential for formation of retinal pigments. Deficiency leads to impaired dark adaptation and night blindness. Question 83. Which is the most common cause of chronic adrenal insufficiency in developed countries? A. Tuberculosis. B. Autoimmune adrenalitis. C. Metastatic carcinoma. D. Amyloidosis. Answer. B. Autoimmune adrenalitis. Explanation. Autoimmune destruction of adrenal cortex is the leading cause of Addison's disease in developed countries, often associated with other autoimmune disorders. Question 84. A patient with suspected bacterial meningitis should receive empiric therapy immediately after? A. CA-safe culture results. B. CT brain. C. Blood cultures. D. MRI brain. Answer. C. Blood cultures. Explanation. In suspected bacterial meningitis, antibiotics should be started immediately after obtaining blood cultures, even before lumbar puncture if delayed. Question 85. Which is the treatment of choice for thyrotoxic crisis thyroid storm? A. Radioiodine ablation. B. Propranolol, antithyroid drugs, and supportive care. C. Levothyroxine. D. Surgery. Answer. B. Propranolol, antithyroid drugs, and supportive care. Explanation. Thyroid storm is a medical emergency treated with beta blockers for symptom control, antithyroid drugs to block hormone synthesis, iodine to block release, and supportive therapy. Question 86. Which is the most common congenital cyanotic heart disease? A. Tetralogy of Fallot. B. Transposition of great arteries. C. Tricuspid atresia. D. Total anomalous pulmonary venous return. Answer. A. Tetralogy of Fallot. Explanation. Tetralogy of Fallot, characterized by 4 defects including GSD and right ventricular outflow tract obstruction, is the most common cause of cyanotic heart disease beyond infancy. Question 87. Which drug is used for medical management of patent ductus arteriosus in a preterm infant? A. Indomethacin. B. Prostaglandin EAC. C. Aspirin. D. Dopamine. Answer. A. Indomethacin. Explanation. Indomethacin, a prostaglandin synthesis inhibitor, promotes closure of a patent ductus arteriosus in preterm infants. Question 88. A patient has pinpoint pupils, respiratory depression, and unconsciousness. Most likely cause? A. Benzodiazepine overdose. B. Opioid overdose. C. Barbiturate overdose. D. Organophosphate poisoning. Answer. B. Opioid overdose. Explanation. The triad of meiosis, respiratory depression, and coma strongly suggests opioid overdose, treated with naloxone. Question 89. Which is the most common cause of secondary amenorrhea after pregnancy? A. Polycystic ovary syndrome. B. Sheehan-Ace syndrome. C. Premature ovarian failure. D. Asherman's syndrome. Answer. D. Asherman's syndrome. Explanation. Asherman's syndrome is intrauterine adhesion formation after curettage, leading to secondary amenorrhea, especially after postpartum hemorrhage. Question 90. In hypocalcemia, which ECG change is seen? A. Short QT interval. B. Prolonged QT interval. C. Tall T waves. D. Flattened T waves. Answer. B. Prolonged QT interval. Explanation. Hypocalcemia prolongs the plateau phase of ventricular action potential, resulting in prolonged QT interval on ECG. Question 91. Which is the drug of choice for pinworm infection Enterobius vermicularis? A. Albendazole. B. Metronidazole. C. Ivermectin. D. Niclosamide. Answer. A. Albendazole. Explanation. Albendazole is the preferred single-dose treatment for pinworm infection, often repeated after 2 weeks to prevent reinfection. Question 92. Which is the earliest sign of increased intracranial pressure in children? A. Papilledema. B. Headache. C. Projectile vomiting. D. Bulging fontanelle. Answer. D. Bulging fontanelle. Explanation. In infants with open fontanelles, bulging of the anterior fontanelle is an early sign of raised intracranial pressure. Question 93. Which drug is contraindicated in hypertrophic obstructive cardiomyopathy? A. Beta blockers. B. Calcium channel blockers. C. Digoxin. D. Disopyramide. Answer. C. Digoxin. Explanation. Digoxin increases myocardial contractility, worsening outflow tract obstruction in hypertrophic obstructive cardiomyopathy. Question 94. Which is the most common cause of epididymitis in young sexually active men? A. Escherichia coli. B. Chlamydia trachomatis. C. Neisseria gonorrhoeae. D. Pseudomonas aeruginosa. Answer. B. Chlamydia trachomatis. Explanation. In men under 35 years, Chlamydia trachomatis is the most common cause of epididymitis, followed by Neisseria gonorrhoeae. Question 95. Which electrolyte abnormality is seen with amphotericin B therapy? A. Hyperkalemia. B. Hyperkalemia. C. Hypernatremia. D. Hypercalcemia. Answer. B. Hyperkalemia. Explanation: amphotericin B causes renal tubular damage, leading to potassium and magnesium wasting, resulting in hyperkalemia and hypomagnesemia. Question 96. Which is the most common cause of painless lower gastrointestinal bleeding in elderly? A. Hemorrhoids. B. Diverticulosis. C. Angiodysplasia. D. Colorectal cancer. Answer. C. Angiodysplasia. Explanation: angiodysplasia, dilated tortuous vessels in the colon, is a common cause of painless lower GI bleeding in elderly patients. Question 97. Which vaccine is contraindicated in pregnancy? A. Tetanus toxoid. B. Influenza inactivated. C. Measles, mumps, and rubella. D. Hepatitis B. Answer. C. Measles, mumps, and rubella. Explanation: Leib attenuated vaccines like MMR are contraindicated in pregnancy due to theoretical risk to the fetus. Question 98. Which nerve injury causes foot drop? A. Femoral nerve. B. Tibial nerve. C. Common peroneal nerve. D. Sciatic nerve. Answer. C. Common peroneal nerve. Explanation: injury to the common peroneal nerve impairs dorsiflexion and eversion of the foot, causing foot drop. Question 99. Which is the gold standard test for diagnosis of gastroesophageal reflux disease? A. Upper GI endoscopy. B. Barium swallow. C. Esophageal pH monitoring. D. Manometry. Answer. C. Esophageal pH monitoring. Explanation: 24-hour esophageal pH monitoring is the gold standard for diagnosing GERD, detecting acid reflux episodes accurately. Question 100. Which is the most common cause of massive hemoptysis? A. Pulmonary tuberculosis. B. Bronchiectasis. C. Lung cancer. D. Mitral stenosis. Answer. B. Bronchiectasis. Explanation: bronchiectasis causes chronic airway inflammation and dilatation of bronchi, leading to recurrent infections and massive hemoptysis due to erosion of bronchial arteries.